Thank you. Thank you very much. And I know we are over time, but I really wanted to thank everyone who has been here today with us. And on behalf of UNITAID and personally, I would also like to share the feeling that Francois was just referring to, that we feel really privileged for having worked these last years with many of you in the room. And we are really proud of the work that has been conducted and the achievements, despite the very numerous challenges we have seen today. I really firmly believe that this collective work has enabled innovations in antiretroviral therapy and many others to become possibly a scale-up for most people in need in accelerated ways. And I know we are over time, but I would like to just mention the 4 keys for such achievements that I have heard today that I consider really important. So first of all, robust evidence. I think we have discussed that at length, and I know I'm singing to the chorus, as you say in English, but it's something that we consider extremely important, evidence and evidence-based decisions. Today in The Lancet, Mabala highlights the introduction of ART during pregnancy being one of the major achievements on public health response to HIV epidemic, and that was only possible because of data. And that evidence comes from PI-led studies in Africa and in other low- and middle-income countries as well. We should not forget that. Second, working in parallel in the evidence and in the market, removing the access barriers, price, patents, lack of patented formulations that Pamela described before, and doing it at the same time as the studies are conducted. Trials alone, science alone, would not have made the change in the treatment paradigm, or would have done it quite late, like we have seen in classic time lags, like 10 years to have tenofovir roll out, or as Kenley just mentioned, lopinavir, ritonavir for children in low and middle income countries, compared to the time when they were already rolled out and preferred treatments in high income countries. In dolutegravir, as you know, by working collectively and simultaneously in the 2 aspects, evidence as well as access, we have been able to reduce that time frame to a third. My third key to success, so evidence working in parallel, is very important as well. We just heard communities and the very various aspects of the work they have been undertaken, but they need to be economically supported. The involvement of community along the cycle is a lesson learned of this portfolio of optimization of ARTs, and we want them to be sustainable and to be able to accomplish such work. And the final one for tonight I wanted to highlight is the role of collaborations and partnerships and information sharing. First of all, thanking very much WHO, first and foremost, for the collaboration they have with us as our key partner in this technical partner in this work, but also among the studies themselves and with many other stakeholders. With USAID, we created a committee, for example, that was led by Meg and the Global Fund, and it's a model of exchange, avoiding duplication and duplicative efforts, and ensuring synergies across studies. This, I really want to thank the generous sharing of everybody in that context. And eventually this led even to a formal data sharing among trials, as you just heard, TRIO. And to conclude, I just want to say that actually, as far as I see in the international global health discussions, beyond HIV, the need to involve low and middle income countries and gather evidence in all populations in need and all contexts is now being recognized as the political and at the funder level. And I think we have learned the lessons with COVID. In the pandemic, by focusing R&D only in one geographical area and not others, we have seen the risk of not being able to recruit because the virus has moved to other regions or continents with a mismatch between disease burden and research. But also when you are trying to recruit in the middle of a peak, you know there are also limitations to recruitment. So finally, I'm now participating, and that's why I'm not here with you, in Maputo with you today, in meetings for the new design of the global architecture to respond to pandemic preparedness and response. And I can confirm that indeed the strengthening of the R&D capacities in all regions, including in Africa, is the highest priority. And hopefully there will be support soon to accomplish such a strengthening. But we also need to look as a priority on efficiencies, moving, for example, to accommodate new methodological innovations on the trials to offset the traditional limitations, and in sustainability. To be ready for pandemic response, we need to anchor that capacity for R&D, of course, in the major public health issues we know that are a big challenge today. And there are many innovations ahead of us that will need such collaborations on R&D. So we really count on you moving forward. And again, just let me repeat here that we are extremely grateful for your work. Thank you.